Hello, cats and kitties. It's Terry Lee here, and today is going to be a mental health video because May is Mental Health Awareness Month. And I want to get rid of the stigma of talking about mental health. So, in other videos, I've talked about my mental health issues. I've talked about my struggles with depression and with an eating disorder. And so, today we're going to talk about a mental health issue. If that's not your thing, or you don't feel that this is a good thing for you to hear, then I will not at all be offended if you click on by or scroll on by. My next video will be true crime, so maybe you can come back for that one. All right, guys, today we are going to talk about anxiety. I know a lot of people say they're anxious. A lot of people say that they're anxious about this or anxious about that. But when we talk about anxiety as a mental condition, we have a very specific definition for that. It's not just I worried about whether or not my lipstick color would go with my makeup. I was anxious about these shoes with this dress. No, we're talking about something a little bit more hardcore than that. Now, my sources for today are the Mayo Clinic, the National Institute of Mental Health, and the DSM-6. 5, excuse me. They're working on 6, don't have it out yet, but the DSM-5. And yes, I do have a master's in counseling. No, I am not licensed, and no, I am in no way counseling you whatsoever in this video. This video is informative, but in no way meant to counsel anybody. And I'm going to tell you some of my experiences with anxiety. But the first thing we're going to do is we're going to get the definition of anxiety. And I got to put my glasses on to do that. So here we go. And according to Mayo Clinic, they define anxiety as a mental condition characterized by excessive apprehensiveness about real or perceived threats, typically leading to avoidance behavior and often to physical symptoms such as increased heart rate or muscle tension. Now, it's interesting that it says about real or perceived threats, because a lot of times people who suffer from anxiety about things that have either not happened or probably will never happen, but they are very anxious about those things to the point where they will avoid situations where they might encounter those things. So anxiety of this type, we're talking about a very real problem that affects your life and how you live it. Not just a worry about, is it going to rain tomorrow? This is a kind of a hardcore type thing. Now, some of the symptoms of anxiety. Anxiety does have actual physical symptoms, just like depression does. And the symptoms are feeling nervous, restless, or tense. Got all those muscles tensed up and you cannot seem to let them go. That can actually lead to pain, muscle tension, neck pain, back pain, just all over pain. Also having a sense of impending danger, panic, or doom. And that can happen even if there's not anything readily apparent that's, happening. If there doesn't have to be anything right there that looks like it's going to be causing doom. You just have a sense of it that it's coming. Having an increased heart rate, breathing rapidly or hyperventilation, which can cause you to pass out if you do it enough. Sweating, trembling, feeling weak or tired, trouble concentrating on anything other than the thing that you're anxious about, trouble sleeping, experiencing gastrointestinal issues, constipation, diarrhea, cramps, any of those things, having difficulty controlling your worry, not being able to turn it off, not being able to at night say, okay, I'm going to worry about this tomorrow. I'll deal with this tomorrow. I'm not going to worry about it tonight. I'm going to go to sleep. No, people with anxiety have trouble doing that sort of thing. Having the urge to avoid things that trigger anxiety. In other words, if there is a thing or a situation that makes you nervous, you might find yourself trying to avoid those things. And I'll give you some examples that I'm dealing with later on in the video. I know very much about what they're talking about there. Okay, there are different types of anxiety disorders. It's not just you're anxious. There are different diagnoses that you can have of anxiety disorders. And so I'm just going to go over a few of the more common ones. The most common one is generalized anxiety disorder, or GAD. And it is a persistent and excessive worry about activities of events, even ordinary or routine issues. The worry is out of proportion to the actual circumstances. It's difficult to control, and it affects how you feel physically. It often occurs with other anxiety disorders or depression. A lot of times, if you have anxiety with depression, it's going to be generalized anxiety disorder. This is when you have a worry that is disproportionate to the thing that you're worrying about. And I'll give you an example of one that I dealt with a while back. I got it in my head that I was going to worry or be more or less obsessed with the idea that the doorbell might ring in the middle of the night. Now, my husband works nights, some nights. He has a rotating schedule. And I had this anxiety about the doorbell ringing in the middle of the night. I couldn't sleep. I thought, what if I go to sleep and the doorbell rings? And it was just, the worry was way out of proportion to it actually happened, because it's never happened. And not to say that it couldn't happen, but it's, the chances are rare that it's going to happen, or small, it's going to happen. But I was so concerned about this. And it just became an anxiety that every night I worried about. And I couldn't go to sleep and turn my head off because, for one thing, I was worrying about the thing happening at night. And it was just, the doorbell. I just got extremely anxious about the doorbell ringing. So that's a type of generalized anxiety disorder where there's something that's common or, isn't that big a deal, but that you're very, very concerned about. Another one right now that I'm dealing with is anxiety over the shrubs in front of my house. They're overgrown. They're overgrown, and we seem to be having trouble getting somebody to come and cut them. We've tried a couple of people. We've called them, and they haven't been able to come. And we had one person come, but they wouldn't haul away the brush, and that was something that we needed to have happen. And I literally avoid looking at the front of the house. Speaking of avoidance, I don't look at the front of the house because I don't want to see the shrubs. And I'm still working on getting someone to cut them, because I just, that's a big thing with me right now, the shrubs in front of the house. I'm worried about what the neighbors think. I'm worried about what people drive by think. I just am just worried about it. So that's an example of worrying more than the situation calls for. Okay, another type of anxiety disorder is panic disorder. This is repeated episodes of intense anxiety, fear, or terror that reach a peak in a matter of minutes. Therefore, it's an attack. So it's a panic attack. There may be feelings of impending doom, shortness of breath, chest pain, rapid fluttering or pounding heartbeat, otherwise known as heart palpitations. And these panic attacks may lead to worrying about them happening again or avoiding situations in which they occurred. Now, panic attacks just come out of nowhere usually. And it really does feel like you're going to pass out. It feels like you might be having a heart attack. I have a friend who has panic attacks, and I was with her when she had one time, and it was a scary experience. It was scary for her. It was scary for me to watch her have it. You can't just say calm down. That's not going to work. You can work with breathing exercises and that sort of thing, but it's a very real thing and very scary when it happens. One of the bad things about panic disorder is you can bring on panic attacks by worrying about panic attacks. So they can perpetuate themselves, and you do tend to avoid places and things that you were around when you had them. My friend had one at a hospital, and so now hospitals are not a fun place for this person anymore. Not that the hospitals are a fun place anyway, but it is difficult for this person to be in a hospital now because of the panic attack that they had there. So, panic disorder, that's one of them, another one of them. Another one is social anxiety disorder. And this involves high levels of anxiety and fear and avoidance of social situations due to feelings of embarrassment, self consciousness, and concern about being judged or viewed negatively by others. In other words, if you are in a social situation, you have an intense fear that people are looking at you, judging the way you look, judging the way you act, that when they're talking to other people, they're talking negatively about you. And you just don't want to be in a social situation because you don't want to put yourself out there for fear of being judged. Now, I know a few people who have this, and it's difficult because they miss out on things. They miss out on activities that otherwise they could be enjoying because of this fear that they have. Another fear is specific phobias. Another anxiety disorder, rather, is specific phobias. These are intense fears of situations or objects, and they can produce a panic attack in some people. They definitely produce avoidance. You tend to avoid things that you have a phobia about. Uh, I do have a specific phobia. It's about spiders. I hate spiders. They scare me to death. If they're any bigger than my pinky nail, then I'm out. No, thank you. I can't even bring myself to, if I kill a big spider, I can't even touch it to get rid of it. I can't even, generally I don't kill a spider. I have someone come do it for me, usually my husband, because I can't touch it. I can't deal. I know a person that has a tarantula as a pet. I can't even wrap my head around that. I had a hard time saying it. So, there are phobias, very specific phobias that people have. Some of the more common ones are heights, claustrophobia, feelings of fear of being enclosed in a tight space or being trapped. Um, let's see, arachnophobia, spiders, like I said, insects, bugs, that kind of thing. So the phobia it's worse than just a not liking something. You can not like something or not want to be near something, but the phobia is actually just a paralyzing, I can't do anything with this fear. If I see a spider in my house, my biggest fear is it's going to go to another room. I have to watch it continuously to make sure it's not moving. It almost has me frozen in fear, and I will yell for someone to come kill it. So I kind of, the specific phobia thing I get, I understand that. Okay, other specified anxiety disorders are unspecified anxiety disorders. These are anxiety disorders that don't meet the criteria for a specific named anxiety disorder, like social anxiety disorder or generalized anxiety disorder, but they do cause enough worry and anxiety to they're significant enough to be distressing and disruptive in your life. They just don't necessarily fit the criteria of the other ones. So there are people that do have unspecified anxiety disorder where they have anxiety, but it just doesn't fit nicely into one of those other categories. Now, we want to talk about obsessive compulsive disorder because a lot of people think that that is an anxiety disorder, and it used to be listed as an anxiety disorder. Now it's gotten its own kind of section in the DSM. It's gotten its own diagnosis as a separate disorder. Due to a couple of differences. Obsessive compulsive disorder deals with rituals that someone has to perform in order to get rid of the bad thoughts or to appease the thoughts. Generally speaking, anxiety disorder doesn't have that. You don't have things you have to do or not do in order to get rid of the anxiety. Basically, the anxiety is just there. Also, different parts of the brain are involved, and there are different ways of treating it, different medicines used to treat it. So it's kind of its own thing, but it is definitely related to anxiety disorder because there are anxieties, but it's just the criteria for obsessive compulsive is different. All right. So, what are some common anxieties? I asked this on my Facebook page for my friends to say, well, what are your common anxieties? And the big two that came out were finances and health. And it could be health for themselves, health for a loved one, family. Family was another one that people had anxiety about. Um, embarrassment, being embarrassed, being disliked. But the two big ones were finances and health. So I'm interested to ask you guys if you have an anxiety that is debilitating, that is affecting your life. What is that anxiety? Is it a phobia, or is it social anxiety, generalized anxiety? You know, you obviously don't have to answer that, but if you do want to answer in comments, that would be interesting. Okay, treatment for anxiety disorder. The first thing is psychotherapy, which is counseling, seeing a therapist, seeing a counselor. And the number one treatment that counselors and therapists use is cognitive behavioral therapy. And that is learning specific skills and thought processes, to control and help alleviate your anxiety. And one of the main ways that that is done is through something called exposure therapy. Exposure therapy is gradually exposing yourself over time to the object or situation that triggers your anxiety in order to build confidence and manage anxiety symptoms. So, like, for example, let's say that your phobia is heights. You have a huge anxiety where heights are concerned. It might be that you go and you visit a tall tower and you just stand next to the tower and you look at the tower. As time goes on, you might climb up a few steps to the tower. Then as time goes on, you might climb up a few more steps to the tower. You might make it halfway up the steps to the tower. Eventually, you might make it to the top of the steps of the tower, and then you might walk onto the tower itself. And you can tell yourself when you're doing these things, you know, nothing's happening to me. There are rails on the steps. There are rails around the tower. You can, you know, tell yourself while you are doing the exposure, you can talk to yourself and give yourself positive thoughts about what is happening. So that's exposure therapy. And it does take a while. You don't just do it in one day or 2 days or a week. Exposure therapy is a long-term therapy where you take small steps. All right. The other way that you can treat, or another type of cognitive behavioral therapy, is rational emotive behavioral therapy. And what that is it's learning to identify and correct negative and incorrect thoughts. So let's go back to the social anxiety thing, where maybe you are concerned that people are looking at you and judging you. Maybe they're judging your outfit. Rational emotional behavioral therapy would have you stop and think, are they really? Is that really? Because what they seem to be doing is talking to each other. No one seems to be staring at you. No one seems, they're enjoying talking to one another. They're not talking about you. So you have to come up with reasons why the thing that you're afraid of probably isn't true. And it's, they're enjoying each other's company. They're laughing and talking with each other. They're not concerned with you. They're not concentrated on you. And so once you learn how to take these negative thoughts and dispute them, and dispute's a very popular word in rational emotional behavior therapy. Once you learn to dispute these negative thoughts, you can replace them with more positive thoughts. Like, I'd like to go over and talk to them too and see what they're talking about. I'd like to join in. I'd like to go to the buffet table and get something to eat because I'm not going to spill my plate in the middle of the floor. So these are ways that you can, talk yourself through negative thoughts. Okay, the second most popular way after psychotherapy to treat anxiety is medication. And there are a couple of types of medication. There's antidepressants, SSRIs. You can use those, and they can treat anxiety in the long term along with depression. You can use buspirone, which is better known as Buspar. It's a very common anxiety medication. Or you can use sedatives, otherwise known as benzos, like Ativan or Xanax. This is a very short-term situation, or a short-term cure, not cure, but treatment. Benzos are, because benzos have addictive properties, and it's very easy to get addicted to them in the long term. I'm sure you've heard of people being addicted to Xanax. And in fact, Xanax is not really prescribed that much anymore, simply because of that. So those are some of the medicines. Now, how common is anxiety? Crazy common. Almost 1 in 5, 18.1%, of people struggle with an anxiety disorder, and that makes it the most common diagnosed mental illness in the US. So, over 50 million people have been diagnosed with an anxiety disorder. That's pretty amazing. Almost 1 in 3 people, or 100 million people at any given time, will struggle with anxiety at some point in their lives. Now, that doesn't mean that it will necessarily be diagnosed and treated, but there will be something that disrupts someone's life from an anxiety standpoint, for almost 1 in 3 people. So that's a lot. That's a lot of people dealing with it. Women are twice as likely to get an anxiety disorder than men are. And nearly half of those suffering from depression are also suffering from an anxiety disorder. Now, I asked on Facebook if any of my friends knew somebody. I didn't ask them if it was themselves, but if they knew somebody that had been professionally diagnosed. And that's important. That's an important distinction, because I wanted to make sure that they had been diagnosed by a professional and they just didn't think they had anxiety. And the response was overwhelming. Many people said, me, I am the person. People said me and other people I know. Some people said other people I know, but there were a lot of answers in the affirmative to that question. So anxiety is prevalent, 1 in 5. That's pretty amazing. That's 20%, well, 18.1%, so nearly 1 in 5, more like 1 in 6. But I noticed my anxiety becoming worse during COVID. I got very concerned about COVID, but also got concerned because I wasn't able to go anywhere. And the way that anxiety has perpetuated itself now for me is that I am very nervous getting in the car and driving somewhere. I did not drive for almost 2 years during COVID, during lockdown. And my husband kept driving because he was considered a necessary worker. So he works for a chemical plant that makes plastics for medical use. So he was a necessary worker and he kept driving and going out. I did not. And this sort of developed into I don't want to go out. I'm not comfortable going out. Sort of a kind of a social anxiety disorder type thing, where I didn't really want to more like an agoraphobia type thing. I just did not want to go into spaces other than the home. The home felt safe. I also did not want to drive because I had not been driving for a long time, and driving concerned me. I thought, what if I've forgotten how to drive? What if I don't know how to drive? To the point where I was having my husband drive me places because I was concerned about it. So within the last, within the last 2 or 3 years, my anxiety has kind of just come up out of nowhere. Now, I've always been a worrier. I've always been concerned about things. I've always been very concerned about how people saw me or judged me or whatever. But I did not feel like I needed treatment for it. I felt like I needed treatment for depression. Depression was my big problem. I did not feel like I needed to seek treatment for anxiety until just recently. And I talked to my psych, and I said, this has been going on for a while now, since COVID, and I don't see it going away, and I might need to talk to you about, what I need to do. And so we agreed on a medication that she thought would help, and we did a medication change of some of the medication I'm on, and we're going to see how that goes. And if that works, great. But if not, we may be looking at some talk therapy, maybe going back to my therapist and saying, there's something going on here that I need to address. And I know some of the cognitive behavioral, through my studies, some of the cognitive behavioral things that I can be doing, but you don't counsel yourself. That's a horrible idea. You don't counsel people you know, and you don't counsel yourself. So I probably, if things do not get better, would need to go and see a counselor or a therapist and talk to them about that. And that is something that I want to encourage you guys. If you're dealing with any of the stuff I talked about here, if you're dealing with general anxiety, if you're dealing with social anxiety or a phobia, definitely talk to your doctor. Talk to your doctor first, your medical doctor. and they might refer you to a psychiatrist or a therapist. And the reason I want you to talk to your medical doctor is anxiety can actually cause medical problems. You want to make sure that you're not dealing with any medical problems from your anxiety. Um, but yeah, just talk to them. Don't get rid of the stigma. Don't think about the stigma. What's important is your health, and mental health is physical health. Mental health is medical health. It's the same thing. There's no difference between going to your doctor and getting a physical and going to your psychiatrist and getting evaluated and going and talking maybe to a therapist. Both of them are treating the body and treating the mind. So basically, that's just what I wanted to talk about anxiety today. If you stayed with me this long, then thank you. I appreciate it. If you're dealing with any of those things, I do hope that you will go and get help, because I want you to live a happy life and a full life. And I'm getting help, so I want you to get it as well. All right, guys, I think that's about it. Next video is going to be true crime. So, come back for that one if you like. If you like the content that you see here, feel free to subscribe and hit the little notification bell, and like this video if you found it interesting and helpful in any way. And I will see you in the next video. Bye-bye.